Okay, so this session's just about complementary therapies and working with the NHS, and I'm just going to demonstrate some acupuncture on Lorraine's back. Lorraine suffers with very stiffness of the thoracic area of her back, and she's been having some acupuncture to actually release the tension and get some comfort from the pain as well. So the main area, main problem with Lorraine is around the thoracic area about here. And with acupuncture we can tap into the underlying muscles and relieve that tension by allowing the energy flow through the meridian lines to balance and correct themselves. Find out the general area with Lorraine and then try and tap into the acupressure points. Sometimes they sting a bit, they buzz. That's a lot of the time you don't generally feel a great deal of pain. Lorraine will let me know anyway, if she does. The area should start flushing up because we are stimulating the underlying tissues, and often the needles start to move as they tap into the energy, and they start stretching out the muscles, the tissues. Already you can see how it's starting to flush up. Again, the general training for an acupuncturist is about 2 years. At Cambridge Acupuncture School or York. With complementary therapies, often it's finding out which therapy the client gets comfort from. You could try massage, hypnotherapy. But with Lorraine, we seem to get some relief from the acupuncture. Probably sometimes put about, depending on the person's problem really, in a shoulder probably about 15 to 20, in a back you might put, I don't know, anything from 10 to 20 to 30, and already you can see how the area is starting to, and it should start tightening up a little bit, but then after a while it releases. Sorry. There's so many different therapies. To choose from, and it is all about the client's preference. There's therapies that induce deep relaxation, and then there's therapies that actually for stimulation and release. And with any complementary therapies, you do have to find out what works for you. A case of trying a few of them and seeing what results you get. I'm just basically trying to loosen off the pressure on Lorraine's back, and we tap into this area and hopefully release it. You okay? Mm-hmm. And she'll be about 15-20 minutes. So we'll keep a check on her, and then we build up the time with experience. These will start to move all over the place as the pressure on the underlying tissues starts pulling and releasing, and we just keep an eye on Lorraine, and we just keep an eye on what's happening in the back. Okay. We often put points in the top and the bottom, but for today, just for the demonstration, I'm just concentrating on this area just to get a little bit of comfort in that area. Do you want those ones in? This is a demanding client who has asked for the pain points in the hands.
Thank you.
Just the hands, yes. Yeah. That sting.
Well, you did that on purpose.
She unfortunately shouldn't have asked for it. Okay.
Thank you.
So I'll demonstrate another therapy which we get a lot of results with within the NHS, Reflexology. We're using it 2 days a week at the cancer hospital on cancer patients who suffer with anxiety, mood-related problems, and fear and phobias. Keep an eye on the time for Lorraine and keep checking that she's okay all the time. So what time is it, Doreen?
20 past.
20 past, good. So both of these therapies are Chinese, especially acupuncture, and then of course reflexology. It's an ancient Chinese therapy that was developed and brought over to Britain in the 1960s. Both of the therapies should induce a really nice sense of well-being, relaxation. Now, Doreen actually can't have acupuncture because of blood problems and heart problems, and also by taking warfarin, which causes a blood thinning medication. So we would not be able to give some acupuncture to Doreen. So the other option is actually then to work manually with another therapy. I could get some cream. So although we've done acupuncture, this is more or less an acupressure. So it's working on the nerve endings on the soles of the feet, but to stimulate the nerves to then give a signal to the brain, and then that responses to the main part of the body. And we can target certain areas, so sleep pattern, digestive problems, bowel problems, stress and anxiety. With complementary therapies, they're different from conventional medicine because, of course, there's no drugs involved. So often the side effects are very, very minimal. You might get some reactions after treatment, but they usually, subside within 24 hours. So there are natural therapies, and we treat the person as a whole. So we try and find out holistically what's kind of going on for this person and how we can give them some comfort. Our main aim as a therapist, complementary therapist, is that we want to try and relax the person as much as possible and induce that well-being feeling and help them to feel like they've had time out, but also, they've had some good work on their symptoms or illnesses or problems. Get really good results with this therapy with multiple sclerosis patients because they have a lot of muscle spasms and stress-related symptoms. So to relax them, they get a lot of comfort. So take 3 deep breaths, please. Okay, so with the reflexology, it basically is really deep acupressure points that stimulate the nerve endings. And the parts of the foot are related to the parts of the body. So we can work down the back, the head, the neck. Now it's quite a deep pressure, and if the person feels a little bit of discomfort, you can ease off or discuss where that area is and how it's affecting them. With a lot of the conventional medicines, the person doesn't get the time out they do with the complementary therapies. As we generally work, we generally check out what's going on for that person. This is all head, brain, sinuses, and we try and link in with any areas of tension. Okay. We generally do get really good results with this therapy. Treatments are usually around about 40 minutes, 45 minutes. Reflexology at the moment is offered to cancer patients who are suffering with anxiety and mood related problems due to treatment, surgery and the diagnosis of cancer. A lot of complementary therapists have to work independently and train independently, and it's just years and years of learning new skills and therapies just to build up, the skills that you have. Knees and hips. We often do one foot, then the other, and then we kind of realise the extra work that needs to be done by picking up the areas of tension. Walking right down the spine, picking up tense areas. That's hips really showing up. complementary therapies are starting to get recognised within the NHS, and a lot of the work is by private practitioners that have trained as clinical therapists as well. Over the next few years, the government are then going to try and tighten up the regulation of complementary therapies, and hopefully will become more recognised for the work we do, and this will enable us to work in hospitals, hospices. Explain. Every part of the foot is usually walked on with the thumb or fingers, and the acupressure is applied to stimulate those nerve endings. Within the college, they have a good range of therapies available on level 3. Massage, Indian head, hot stones, reflexology, aromatherapy. Now that's a 20-minute just basic treatment from start to finish, and then the extra work will be devoted to Doreen's conditions or what's showing up, or the extra work that she needs if she's not sleeping, or if her hip and pelvic area is really tender. But that's a basic treatment from start to finish, just to check out the acupressure points. Right, maybe sort out Lorraine. What I'll do is I'll take the pins out, and then that's it. Okay, because then I'm just going to loosen off Lorraine's back with a bit of massage. Oh. It's up to you. I'm just going to, I'm going to take them out, so you can do if you want to. Right, we just check out what's going on here. Of course, we've got lovely erythema, which is the reddening of the area. And again, we just check out kind of how nice and soft it is now from that tightness. We've got a lovely, relaxed spinous rectus muscle, which is that's what we're after. Okay, so sometimes, of course, with the odd pins, you can't help hitting a capillary because the skin has small capillaries underneath. So if any of them bleed, then that's okay too. Yeah.